According to a new report designed to guide public health policy, plastics pose an unrecognized threat to human health due to the endocrine-disrupting chemicals that they introduce to the human body. Is that really news to anyone? The last time I checked, policymakers and doctors all have advanced degrees. And if they had bothered to read the literature over the past 15 years, there would be nothing unrecognized about the threat plastics pose to health. Regardless, this report defines endocrine disrupting chemicals, or EDCs, as any chemical or combination of chemicals that interfere with hormone activity within the body. Hormones mediate just about every crucial function in your body, and they must be released in the right quantities at the right times, or things can go very wrong, especially where growth and reproductive development are concerned. And given the abundance of EDCs in our environment, is it really any wonder why we're seeing infertility issues on the rise and low testosterone levels in men of all ages? To make matters worse, we've only just scraped the tip of the iceberg when it comes to exactly how many endocrine disrupting chemicals are really floating around out there. Simply put, the more plastic you use, the higher your likelihood of exposure. The only truly safe way to reduce your exposure is to stop using plastic altogether. Now, I know that might not always be feasible, but there are some simple steps you can take at least to limit your exposure. First, stop heating up your food in plastic containers. Never reuse your takeout containers. Use glass containers instead. Try not to drink out of plastic bottles or plastic straws, and use stainless steel, wooden, or biodegradable utensils. This may not seem like big changes, and they're really not, but even small efforts can go a long way in protecting your health and the environment. So if you ask me, they're well worth it. Until next time, I'm Dr. Fred.